But I thought I would just bring some statistics, and this was just as of today. I'll speak mainly, we'll look at the country as a whole, that there are 27 million known cases of COVID-affected patients. Out of that, there are over 480,000 deaths attributed to the COVID disease, and that amounts to about 2% of cases. Now, in North Carolina, our statistics are slightly over 800,000 cases, 826,000 as of today, with 10,500 deaths, which is about 1% of the cases result in death. And then focusing yet again in our county, Nash County, we've had a little over 9,300 cases with 155 deaths. So it's roughly 1.5% fatality rate. So, you know, this is it's a disease that can strike all ages, but it particularly strikes those over age 75, 80 and older extremely hard, extremely hard. Or if you're 65 or older, but you have mitigating diseases, and those could be diabetes or elevated blood sugars, not approaching diabetes, but where you're insulin resistant. We've talked about that on our program previously. High blood pressure is a known mitigating circumstance. If you have pre-existing lung disease, heart disease, these are mitigating circumstances that can turn a relatively less severe case of COVID into a very severe case of COVID. So, you know, that's the bottom line. Now, most people recover from this, okay? And especially the younger patients really recover quite well. Again, unless they have a mitigating pre-existing condition. You know, probably 80% of everybody that gets this will think they just have a bad virus, a bad case of flu. Now that we know that COVID is out there, and speaking about flu, by the way, that's an interesting topic real quickly. You know, normally this time of year, mid-February, is in the past when we would peak with our flu cases. Now, the last few years, and I've been here practicing for 37 years, so I have a little bit of track record. The last 4, 5, 6 years, we've actually seen the peak of flu season move much, much more towards later in the spring. In fact, the last few years, it's been April and even May when we've peaked. So, you know, we can knock on wood. We've seen hardly any flu cases, to be quite honest. But we don't want to count our chickens before they hatch. So stay tuned. If you do come down with symptoms of illness, you know, certainly think COVID first, but don't rule out that you could be getting flu. And you know, there is a test for that, different from the COVID test. Now, it may be administered in a similar way. We usually go up the nose for the flu test, but we can rapidly know, usually within 30 minutes, whether a person has flu or not. And there are adequate, definite treatments indicated for combating the flu. So just keep that in mind as we head into the rest of February, March, and April. You know, COVID affects multi-organs, and it can compromise your lungs. You know, one of the hallmarks is this cough, shortness of breath. Now, one of the scary things is low oxygen. You know, we have more patients now that have their own oxygen meter. You can pick it up at your local drugstore, and you monitor your oxygen. And, you know, that's a very, very important thing to monitor because, you know, once you get short of breath with COVID, you need to get to the hospital right away. You don't have as much time to just wait it out. At that point, it becomes very, very, very serious. The GI tract, we know nausea, vomiting, especially diarrhea, is a big component in COVID. Kidney failure happens. It's one of the more severe manifestations of COVID. The nervous system, one of the hallmarks seems to be that a person loses their sense of smell or taste. And my brother in Florida actually came down with COVID, and he's done quite well. But I'll joke with him. I said, well, you lost your sense of smell, huh? That might be actually good for him, but we will go into that part of it. But, the heart also, the vascular system, and this is one of the things that we've studied in the past with regard to flu patients. And one of the things that can cause death from flu is that the person gets over their flu symptoms, and a week later they may succumb and die. And if it's not of overwhelming pneumonia, which is a different set of complications from flu, it's because flu, as a hallmark of many viruses, and COVID is the same way, it initiates a storm of inflammation throughout the body. If you have a pre-existing plaque in your arteries that was previously not vulnerable, it wasn't going to rupture, but with this overwhelming inflammation, what they've seen on post-mortem examinations is that these plaques all of a sudden are so inflamed that they go from not being vulnerable to being vulnerable. And what we mean by that is they actually rupture. And that's where you can get into heart attacks and strokes. And that's what people are dying of post-flu a week out. And we believe we're seeing the same thing with COVID as well. So, the cardiovascular system and the blood vessels take a huge hit when you have COVID. So, and we're going to talk in our second segment this evening, we're going to talk about heart disease, because February is Heart Month. So stay tuned. We'll be talking about that shortly. I wanted to make sure that we talked about, before we finish our first segment this evening, I wanted to make sure that we talked about the vaccine. There are the two approved vaccines. Now, Pfizer's starting to phase out a little bit because the storage has to be so deep freeze. It's hard for that to be stored all over. But I might want to let everybody know, if you're waiting to get your second shot, be aware of this. You may have experienced very little with your first shot, and we hope that will be the case with your second shot. But I would plan to have a little bit different reaction on your second vaccination. You might want to plan to not be busy that next day after you get it, because you may develop fevers, chills, aching, really feel kind of lousy, to be quite honest. Maybe still have the swelling around the vaccination site. All three of us in my MDVIP office took the vaccine. We want to protect ourselves, and we want to provide protection for our patients. My two wonderful assistants, Bridget and Grayson, both could not come into work that following day because they really, really were ill after the second vaccination. I was about 95% out of 100, so I was in the office doing paperwork and stuff like that, answering the phones, and I guarantee you I don't want to answer the phones. I'd rather be a doctor. But at any rate, be aware of that when you're getting your second vaccination. You may want to really make plans to be just not doing a whole lot that next day. If it turns out that you don't have a major reaction to it, then have fun just doing whatever you normally would do. But we've seen more of that. You might want to alternate the arm that you get it in. If you got it on one side, have the second vaccination on the other side. Be sure to take Tylenol. If you feel lousy, that's a very adequate way to deal with it. And just kind of tough it out. It's generally the 24 hours after the vaccination that the tough stuff is there. Alrighty, but just wanted to bring that out. I don't have to wear my face mask in here because it's just me and you at home on the TV. But, wearing your mask, social distancing, still very, very important. Washing your hands. In our office, actually, we've taken extra precautions. We actually have a nanotechnology that we've had sprayed throughout our office, and we have this done every 3 months. Literally, nothing grows on surfaces. Nothing grows on them, including our beloved favorite new virus. So, unless you take a Brillo pad and just literally scrape the stuff off, it's good for 3 months, and actually on things like furniture, sofas, it's been shown to be good for a year. So we, again, take these precautions to help my staff, myself, cut down on our potential exposure, and also to help our patients. So, this is important. Eat healthy, sleep, get your rest. Try to exercise, but not in excess. I think one of the things that is so difficult for folks is we're being confined. We're being confined in the home. It's during the winter. The weather's been pretty lousy. Everybody is getting really depressed by just a change in our lifestyle. We're not seeing people that are not connected via computer and the internet. These folks are isolated, and it's really tough on them. So if you have family members, reach out to them. If they're not computer savvy, maybe you can help them become that way. Reach out to them on a phone. Please don't let people become isolated and really get depressed, because we just don't need that. We don't need that. So at any rate, so we're going to take a break, I think, coming up in just a few minutes, but I just wanted to hit COVID again real quickly and just give an overview of the vaccinations, and what to expect from them. So we're going to be talking about the heart in our next segment, and vascular disease, what it means, how do you know you have it, what are the warning symptoms, what are the warning signs, and we'll be doing that in the next segment. So stay tuned, folks.
Local businesses in Wilson, Nash, and Edgecombe counties have something to share with you.
Hey there, I'm Chuck.
And I'm Brian.
Serving Rocky Mount since 1927.
Thank you for allowing us to serve you for another generation.
Hi, I'm Terry with Lillian Lane, and just wanted to let you know that we've got 40% off of all of our winter apparel, and we've got some great things coming in for spring. They are arriving daily, so please stop by, say hello, and check it out.
Brought to you by WHIG and these fine businesses.
At Badcock Home Furniture and More, Steve found the perfect mattress, and Sue found everything else she needed to feel cozy and comfortable. Give yourself and your loved ones the gift of better comfort and sleep. Save up to 50% on select bedding and more. Plus, choose from other year-end mattress offers, all with no credit refused. Get the best bedding deals of the year, only at Badcock's Gift of Sleep Sale. For details, visit badcock.com.
Well, welcome back, folks. We're going to be, since February is Heart Month, let's go ahead and take a little journey into that part of our health. And so we'll go ahead and begin talking about this. And, you know, as bad as COVID is, and as bad as cancer is, the leading cause of death in our country is still cardiovascular disease. And by that we mean we kind of group together three items: heart attacks, stroke, and heart failure. So we'll group those together and call that cardiovascular disease. And it is the leading killer in our country. And, you know, isn't it nice to think that if I have the bad guys around me, that I have a little warning. I have a little idea that they're in my vicinity and they're getting close, and I better pay attention, and I better take appropriate action to make sure I don't, you know, let them get me, right? Well, in an ideal world, that would happen, and we'd have little alarm systems triggering things off. You know, think about your car. You know, if you, my wife was driving to see our grandkids this weekend, and little light went off, and it said tire pressure was low, and sure enough, she had picked up a nail, and fortunately, Lord granted her grace because she was able to stop near a Walmart on her way, and they patched the tire. But you know, without that warning and that light flashing on the dashboard, you know, that tire would have gone down all the way to the nub, and who knows, she might have been in the middle of nowhere. So we use these warning things to let us know. I mean, how many people fill your car up with gas and never look at the fuel gauge again? You know, I don't think you'd really want to do that, because when you're finally getting low on gas, you know, how are you going to know? Your car is driving perfectly right up until the point where it starts coughing and it just stops. It stops in the middle of maybe nowhere, and you're in a pickle, right? So we use these warning lights, if you will, to let us know that our car has difficulties, or we need to fill up our gas tank. You know, all of these things kind of are clues. You know, if the lights start going down low, and when you're kicking that engine over, it starts to sputter a little bit, you know, maybe I better check that battery. You know, maybe it's starting to get low on me. So, you know, we all use warning things to give us a heads up, right? And what about heart disease? What about heart disease? Well, you know, there can be classical warning symptoms. I remember seeing a patient. He was coming in just for his regular exam. This is several years ago. And, you know, we started talking about different things. We asked certain questions of the patient. And it never dawned on him that when he was pushing his lawnmower around, doing his yard work, and he started feeling very uncomfortable in his chest, he just would stop what he was doing for a minute or two, and the symptoms would go away, and he'd just start back pushing the lawnmower again. Well, he didn't connect those dots and realize that that was a warning symptom that he was having of pretty bad significant heart disease. So, you know, sometimes we can actually have symptoms. You know, they might be symptoms of chest discomfort. We don't even use the word pain as much because it can be so varied. I mean, the classic is like the elephant sitting on the chest, but it may not be that at all. It may just be a slight discomfort. Usually it's with exercise. Usually it's exercise induced or associated. So, you know, it's usually with that, but a person may not have chest discomfort at all. It may be just shortness of breath. You know, it may be after eating a huge meal that I'll get this chest discomfort. Now, that doesn't mean that it's cardiac. It could be other things, gallbladder issues and so forth. But these are symptoms, and it's often hard, unless you're trained in the medical field, to associate that with, maybe something's up with my heart. The scary thing, quite honestly, is this. Many, many, many people that have heart disease, the first manifestation is cardiac arrest and sudden death. Now, that's tough, because if that's your first manifestation, you didn't even have a chance to try to combat it. You didn't have a chance to recognize it and deal with it. So that is difficult, but it's not uncommon. I mean, one of the big studies of postmenopausal women in past years showed that half of them experiencing sudden cardiac arrest and death had no preceding symptoms whatsoever. So it's really difficult, if you don't look for the warning lights going off. Now, there are certain things and warning lights that your doctor will use. So a lot of this is driven by your history. So asking the questions, having the time to ask questions, go into things, delve into them, is very, very, very important, okay? But there are blood tests, and we utilize these in the MDVIP practice that I'm involved with now. And these are our markers, and I'm going to show you a little picture of a cross-section of an artery. And we'll flash that up there for you in just a moment. But along the top, you'll see that there is a progression. If you're looking at it, you'll see there's a progression from one end of the screen to the other end of the screen. And where there's a blood clot, see that blood clot in the artery there? Now that's a bad thing happening. And we want to avoid that, or at least we want to have that when we're in our 90s, okay? Not when we're in our 60s, 50s, or 40s. And believe it or not, it's happening in people in the mid-30s age range. And this is scary. This is scary. But there's a progression that happens. It doesn't just jump from one end of the screen to the other end of the screen. And you'll notice across the top that there are certain names of tests, and these are blood tests. And one of the ones, several of the ones that we do within our program are the ADMA, the HSCRP, and the myeloperoxidase tests. Now these are standard in my MDVIP practice that we will do on your executive profile. Now what are these? These are blood tests that are associated with presence of cardiovascular disease. And these are like little warning lights. If I see these warning lights going off, even if you don't have known heart disease, this is raising a red flag, and you and I as a patient will talk about this. Now these are tests that your regular doctor can order, and so these are indicators of something going on in the vascular bed. And as you know, one of my first guests on this program was Dr. Cromwell. He's an acknowledged expert in the lipid field. That's his area of expertise. And I actually have conned him into coming into my practice and doing a vascular test, an ultrasound test on the arteries. If we have suspicion, this is the next level that we go to. There's no needles and that type of thing. There's no dye. It's a painless test. And we can determine whether you indeed have plaque buildup. He jokes about it with me. I've sent him one normal patient from Rocky Mount, and he remarked, "You finally sent me a normal. Thank you." But it's amazing, and it's a little scary too, because we're finding plaque in people in their late 20s and early to mid 30s. So this can start early. Now that's the bad news. The good news is we can do something about it. We can actually limit the progression of that plaque, and we will be talking about that in our next segment, and we'll have the call-ins as well.
We have a call.
Oh, we do have a call.
Someone has already called.
Okay, we have a call.
They want to know how how they know whether it's angina or a heart attack?
Okay, that's a great question. What is the difference between angina and a heart attack? Okay. Well, let's talk about what angina is. Angina is basically, it's a mismatch in the demand that a muscle has for oxygen-carrying blood and what available there is to supply that organ. Now, typically we're talking about the heart. And if it's angina, if we can allow, let me go back to that patient that I mentioned. He's pushing his lawnmower, okay? He's exerting himself. The oxygen demands of a muscle that is at rest is different than when the muscle is being used. So in this case, he's using his muscles in his body. His heart is having to pump more blood. And in this case, he had blockages in arteries supplying the heart muscle. So when there was a increased need for oxygen, instead of getting that increased oxygen flow because he had this plaque buildup in his arteries, it wasn't able to do the increased need. And so what happens is, in a truly working system, the muscle says, ouch, I'm hurting. There's an actual symptom. And in that case, that's angina. Now, if this process goes on and we don't allow that heart to relax and settle down and have decreased need for oxygen, and if we're not allowing that to happen and there's not enough oxygen getting there, the muscle will actually die. What happens is, during a heart attack, a certain part of the heart that needed that blood, that oxygen, wasn't getting it, and it actually dies. And that is, we can actually measure, when the heart muscle dies, we can actually measure that it's spilled into the bloodstream. And this is why when you go to be evaluated in an emergency room for a possible heart attack, I had chest pain, they'll do blood tests and they'll be checking to see if there was any leakage of these substances into the blood, indicating that there was some degree of heart damage. So, great question. You know, if you can stop angina quickly, and there are different ways you can do that. This is where the baby aspirin can help if you haven't been taking it. Nitroglycerin. People that have known heart disease will use nitroglycerin. That dilates the blood vessels and it allows more oxygen to flow even through a somewhat limited system, and it can help thwart a heart attack. In the emergency room on an acute setting, remember that blood clot we showed on that picture? Well, what's happening in an acute setting is we're giving clot busters, okay? So we can give things intravenously. So imagine you are having the worst angina attack. It feels like an elephant on your chest. You're sweating, you're maybe throwing up, very short of breath. This is in the midst of a heart attack happening. They can assess whether that is happening, and if it is, they can give an intravenous clot buster. Now, what happens is they're trying to dissolve that clot, that scab, if you will, that's sitting on top of that plaque that ruptured. They're trying to dissolve that. And if they can get a millimeter or two more breathing room, dissolve that clot, that can make all the difference. Almost immediately, we can see changes. The electrocardiogram returns back to normal. The patient immediately feels better, and that can happen with a stroke in progress as well. So, great question, folks. Great question. Okay, well, we're going to be cutting to a break in just a moment, and we'll field more questions. If you don't, you're going to be subject to me talking some more. So, you all call in, okay?
What makes Premier Equipment Company premier? Our employees. People trained in the latest technology. People who love our customers and take pride in our products and service. People who love a job well done. With 2 locations to serve you in Infield and Rocky Mount, we're easy to find and easy to do business with. Premier service, premier parts, premier employees, premier equipment. Now selling Massey Ferguson at our Infield location.
Local businesses in Wilson, Nash, and Edgecombe counties have something to share with you.
Hey there, I'm Chuck.
And I'm Brian.
Serving Rocky Mount since 1927.
Thank you for allowing us to serve you for another generation.
Hi, I'm Terry with Lillian Lane, and just wanted to let you know that we've got 40% off of all of our winter apparel, and we've got some great things coming in for spring. They are arriving daily, so please stop by, say hello, and check it out.
Brought to you by WHIG and these fine businesses.
Why not treat yourself or your sweetheart to a new car or truck for Valentine's Day? Our lot has over 30 different new cars and trucks to choose from. You can save thousands of dollars. That's right, thousands. Your car, new or pre-owned, is right here at the payment you want. Go to bullockchevrolet.com. Our inventory and prices are updated daily. Happy Valentine's Day from John Bullock Chevrolet, doing business the better way for over 100 years.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't rise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
Well, welcome back, folks. We're going to be dealing with heart disease again in this final segment, and we're welcoming your calls if you're live this evening. Great question, the previous questioner. Thank you. You know, there's a great movie. It's a classic movie. It's called Casablanca, and you know, Humphrey Bogart was in it, and there was a classic line near the end that we're going to round up the usual suspects. Well, when we're dealing with heart disease, let me ask you, what do you think the usual suspects are? Any ideas? You know what? Let me rephrase that. Let's go back to our little picture there. And you'll notice that if you start on the far side, the left-hand side of your screen, you know, that artery is very, very clean. If you look at the little pink line on the inside of that artery, but as it goes farther and farther to the right, you'll notice that pink area starts to thicken. It starts to enlarge. It gets bigger and bigger. And then you can see that bulge in that middle frame, and that's where that plaque is getting bigger and bigger. And it becomes so stretched that it becomes what we call vulnerable to bursting. It's like a little balloon, if you will. Think about a little balloon. Now, we can do 3 things with a balloon. You can blow air into it, and if you keep blowing air into a balloon, what might happen? You can see in that next little slide there, it pops. And then remember what happens? That blood clot, that scab can develop on top, and then we have a world of hurt happening to us, a stroke or a heart attack. Let me go back to that middle area. You know, that plaque, like a balloon, hey, what happens if it just stays like it is? We don't add any more air to the balloon, and it just stays there. You know, that can be a stable plaque. Now, people can have plaque, but if it's stable, it just sits there. And unless it's really pronounced, it won't limit your blood flow, and life can go on. You know, the great thing would be what? To take air out of the balloon. Now that's a lot harder to do, but it's possible. So let's talk about things that, what are the usual suspects that we know that can take something from just thickening and develop it into that plaque and then even make it worse. Well, what are some of the things, folks? I think you know what some of them are. How about cigarette smoking? You know, you can have the best numbers around, but if you smoke, we know that that will grow this plaque. And people, you know, one of the big things after having a heart attack, quite honestly, is getting people to stop smoking. You know, it's very difficult. It is not easy to do. You know, that's not an easy habit to get rid of, but it is extraordinarily productive in terms of limiting second heart attacks or second strokes. So we know that smoking can make that plaque grow. Well, what about other things? High blood pressure. You know, fortunately, when I came out of my training at Duke many years ago, we basically had a half dozen or so blood pressure medicines available to us. And, you know, there were entire classes of blood pressure medicines that we have available now that were not even invented back then. So we can really control blood pressure well. But folks, when it's not controlled, it can grow this plaque. And that's a bad thing to have happen. Well, what about blood sugar? What about blood sugar? What about diabetes? You better believe that diabetes will grow plaque. We know that patients with diabetes have an increased risk of heart attack and stroke. And folks, you know, that's difficult. What happens if you're pre-diabetic? What happens if you're not quite bad enough to be called diabetic, but you're pre-diabetic? That's also a contributor to this growth of plaque. You know, one of the biggest causes is cholesterol. Now, a lot of people think they have a normal cholesterol, but I will tell you, over the years, what was judged to be normal cholesterol values has been much more precisely looked at with having more studies. And quite honestly, it's, you know, there are standard cholesterol tests and there are more advanced cholesterol tests. And depending upon the clinical expertise of your physician, your provider, you know, sometimes you can guess the cholesterol from a standard cholesterol test, but oftentimes there's a mismatch, and you honestly can't tell that there's a problem until you do an advanced test. And again, some of the advanced tests we do in our MDVIP program I mentioned earlier on that diagram. Do we have another call?
Yes. This gentleman said he's heard that your left arm can hurt with a heart attack. He said, but can your right arm hurt?
Wow, great question. You folks are on top of it tonight. Okay, the question was, your arms can hurt. That may be one of the symptoms that can occur. And, you know, the caller said, well, I've heard that the left arm can hurt, and that's kind of the classic pattern. But could your right arm hurt? And the answer is it can. In fact, you could have neither arm hurting, or you can have both arms hurting. So again, you know, one of the ways that your doctor or provider will try to tease out whether your arm pain has to do with heart, you know, remember we have a joint here. You know, we have a shoulder joint, we have an elbow joint. You know, is the pain coming strictly from a musculoskeletal cause, or is it coming from perhaps the heart? And this is what we tease out when we ask you questions. How did you tell me the circumstances in which you had the arm pain? But to answer the question specifically, either arm can hurt, or sometimes neither arm hurts, but you may have those other symptoms we talked about. So great question, great question. So we were talking about the usual suspects and what can grow plaque. So we know that elevated cholesterol levels or elevated cholesterol particles independent of what your cholesterol value truly is. Because if you have a lot of these lipid particles, the L particles, even if they are not filled with much cholesterol, it can cause plaque to grow. Now, the key things is that if we've identified that you have these usual suspects that we know can create and grow plaque, then we need to address these as risk factors. And this is what your provider will be spending a lot of time doing. And you know, you need time to address these things. You know, I know that you all think that all we do is write prescriptions, right? And we do a bunch of that, that's for sure, because we do have great medications that can address things like blood sugar and cholesterol and blood pressure. But do you know that there are non-medication approaches to all of these problems? Now, I will tell you, it's probably easier for you to take a pill and get it filled at the drugstore than it would be to perhaps engage in a better lifestyle. But I can tell you that a better lifestyle has dramatic improvements. For every pound that you lose, you may drop your systolic blood pressure by 1 point. Lose 10 pounds, you may affect your blood pressure drop by 10 points. That's wonderful. I have a patient right now in my MDVIP practice. He's done such an amazing job. We've actually, this week, I actually took him off his last remaining blood pressure medicine because he's lost over 50 pounds by following a lifestyle modification program. And the only way we were really able to do this, we had to take time to explain how to do it. But he's motivated, he's looking great, and we've actually been able to reduce his medication, which is a thrill for us, really a thrill for him too. So, you know, we treat these things, but it's not always with a pill, folks. And I think that that's one of the benefits I see in my practice now that I have much more time. You know, your average time with me is going to be 30 minutes in a follow-up, not 5, not 8, which is pretty traditional. So we have more time to talk about things. You know, rather than just hand you a handout on a diet, we have time to actually go through it and talk about it, answer any questions you've got. So I think it makes a difference because when you as a patient kind of know the particulars about something like that, you're more likely to engage it, actually. So I think that the ways to combat these things that we know are suspects in creating plaque, you know, that's where the money is. Now, again, detecting disease is important. You know, if I see those red flags going off, I'm going to recommend that we do a non-invasive test that's very affordable, that we can know immediately whether you have plaque buildup. You know, if we find you have plaque buildup here, it's the same process throughout the body, and we know that you could have it in other organ systems. But you know, the good news again is that once we know you have that problem, we ratchet things up. You know, it's like grade inflation. You know, when I was in school, to get an A, all you had to do is get a 90 or above, and that was an A back in the old days. But now, when my kids were going to school, it was 92, 93, maybe even now it's 94 to get an A. You know, it doesn't seem fair that you have to score better to get the same grade, but that's what happens. And if I know that you have plaque buildup, and we were satisfied previously with a certain threshold in your blood pressure, in your blood sugar, in your cholesterol values, but all of a sudden I know that you have that plaque, and we do not want to add air to that balloon, folks, because we know what can happen. We know what can happen. So we don't want to add air. Now, it'd be wonderful to take air out of the balloon, but let's first of all stop the progression. And to do that, we have to ratchet things down. And the the societies that are in charge of giving guidelines to us as physicians will modify those threshold values in the presence of disease. So, you know, that's why it's important to pay attention. Do you have these things that can grow the plaque? And if so, let's not hang our heads. Let's go after this. Let's fight this. Okay, let's fight this. So, you know, we welcome new patients to the MDVIP program. You know, there's a certain cap that I will not exceed because I don't want to get into the process where I don't have the time to deal with your issues, and I can't give you that 30-minute follow-up. And by the way, when we do your executive examination, there's an hour-long testing that happens. 2 weeks later, you have a 90-minute debrief with me. And we generally spend the full 90 minutes going over all the details of your examination and then what are the next steps. So it's rewarding in that respect, and we welcome folks to engage. And if you want to come in for just a meet and greet consult with me, just be in touch with Bridget Pridgeon. You can see her email there, and then also they'll flash up near the end. That's our number, 451-7043. So we welcome folks to engage us to find out more about the program. But I want to give a little teaser for next month. Next month in March. Now, folks, I know we've had it up to here with winter. We had a tease today. It almost felt like spring. But by March, I hope, you know, we're going to be really feeling like it's springtime. And I know what that means for a lot of people. It means, hey, I'm going to maybe get in a bathing suit and get to the beach. Maybe this summer we will be able to do that, right? COVID will be in the rearview mirror, we hope. Well, I'm going to bring in an expert, and whether he's going to be here in person or by phone. But stay tuned for next month, because we're going to be talking about obesity, weight. What do we do about it? Why is it a problem? What are some of the potential solutions? So I want you to be prepared to attend that month, next month in March, and we'll have a wonderful time talking about that so that you can get ready for beach weather, okay? All righty. Well, it's great having everybody, great having the call-ins tonight, and better health to you. We'll see you next time.
Hi, my name is Victoria Brattan, and I'm with Down East Hearing Care Associates. I'm an audioprosthologist who specializes in hearing rehabilitation, but I also look at awareness and how to protect your ears against the elements. So the first thing we're going to talk about today is about ear protection for your ears when you're swimming. Most children have swimmer's ear. Most people who have problems with their middle ear may have some leakage from the eardrum, so they want to protect the external part of their ear and their middle ear by putting ear protection in. So what we have here today are some pre-formed type of swimmer plugs. So if your ears are very small or the child's ears are developing very quickly, you're not going to want something that's custom to the person's ear, but you could have something that would be molded very easily. So these little drops that we call are actually ear protection for swimmers. So all you have to do is you soften the material by rolling it around between the fingers, and then you actually place it into the ear canal, and you spread it out within the bowl area. And this makes it easy for your children to go swimming without having any water collected into the middle ear. If they go into the bathtub and they don't like water into their ears, this is also a very good solution. If you're not interested in something that you can preform yourself, we do actually make custom swimmer plugs also to help protect the ear. We look forward to seeing you in our office. You can look at other details at downeasthearingcare.com. Thank you so much and have a blessed day.